So the first thing you'll do is I will send out a email to most likely your work email address. This email will contain a username and a password, and you're going to use that to set up your agent access. So the first thing you need to do is just click the link. It'll open up a new window, and this will be the page where you will access open enrollment. So you're going to use that work email address. This email I am using is xg. So again, the work address is most likely going to be what you're going to use here as I set each of you up for open enrollment. But you're just going to type that in the top line. That will be your username for this site. And then your password is going to be what was in that email. So you can copy and paste, or you can just type it over. And it will have you reset that password once you get logged in. So once you get your new username and password put in and you click login, you'll see the green bar going across the top of the screen. It'll let you know that your temporary password has expired, and that you will also get an access code to that email that you're set up with. So the first thing I would do is go back to your email. Make sure you do not close this MemberXG window, and you're going to check and see if you have received an email yet. So mine just came in. It says, here's the access code generated for you. And it's usually 6 numbers. So I'm going to copy that into the access code box. The next thing I'm going to do is create a new password. So again, the password must have at least 8 characters, contain a lowercase and an uppercase letter, and at least a number and a special character. Once you've typed that into both boxes, you're going to click Finish. And you'll see the green bar going across the top of the screen again. That's just it loading. Okay, so now you have successfully reset your password. Make sure you've written what you put in down so that you can remember it for the future. Now you can go ahead and log in at any point in time to enroll individuals. What you'll do is again use your work email. I'm going to use the email that I have set up as an example. And then you're going to enter that password that you just created. You're going to click Login, and it will take you to the page to enroll individuals for open enrollment. So the first time that you log into this, it will ask you for an access code again, just to verify that you are who you are. You can see how quick it sends an email out. There's the reset, password successful, and there is the next access code. Very important. Make sure that you're not using the access code you had used previously when you were first setting up your password. You're going to use the newest email that you've received from MemberXG. Again, it's usually 6 numbers. Copy that over and paste it into the access code box, and then click Verify and Login. You can see you have successfully logged in, and it says welcome. It should say your name. I'm using the Eric test account, and then from here you can enroll anyone for open enrollment. So the first thing you'll do is you'll need to enter the member's information so that you can access their account. So I will be enrolling Snow White. Once you have all that member's information, you want to enter it into the boxes. It's important that you have all the information, so if someone does not know their date of birth, which happens, or they don't know the last 4 digits of their social or their zip code, we'll have to do their enrollment later on. They need to come back with that information. So I'm going to enter this information in for Snow White and click Search. You can see next to each field there's a red asterisk. That just means that that is required to log on for open enrollment. Alright, so this member was assigned to me to enroll. And then I'm going to go ahead and click Enrollment. So as you can see, it says Welcome to Enrollment 2019. If the individual is eligible to enroll, they will have active enrollment January 1, 2019 through December 31st, 2019. It's like a hyperlink available for you to click. If this is not here, that individual is not showing eligibility for enrollment, or they're a paper enrollment, or they might be a specific situation that needs to contact the fund to figure out what exactly we need to do for them. So you can direct them to us if there's nothing there in the active enrollment section. So I'm going to go ahead and click the link and get started in enrolling Snow White. First, you have to accept the terms and conditions, just the standard information there. The next thing you can do is verify the address is up to date. That's what it's just yelling at you here in the orange box. So I have Snow White and Prince White. I have their date of births, their social security numbers, their gender, address. So if any of this information needed to be changed, you could click edit. If any of these individuals, say there was 4 or 5 individuals here that needed to be added, deleted, or removed, you could delete them here, or you could add them by using the plus. I'm not going to change any of our information because it looks correct to me. Next is the actual election page. So this page is very important because this is where you're choosing what they will be enrolling in. So the first thing you'll want to do is decide what coverage these individuals will have. So this Snow White is set up as a Southwest 2019 enrollment. She is eligible for Plan A and Plan B, and then ancillary only coverage. She can also waive coverage as well by clicking Decline Coverage. So if you look at Plan A, it shows that it is an 80% in-network with a $750 single deductible and a $1,500 family deductible. So the basics of the plan are listed in this top box. If I go down to the coverage type, this is where you're going to select who all she's covering within this plan. Some of it you may have to scroll over to see what the other information is. Otherwise, you can just select one of these. So if I were to enroll her in just member-only coverage, I would click Member, and it says Member-Only Full Plan, which means medical, dental, vision, life, A&S, and prescription. And then it also mentions the biometric screening that's due by December 15th. It shows what their premium would be without the biometric, and it shows what their weekly premium would be if they did complete the biometric screening. This system is not going to know whether or not they've completed their biometric screening. We must just show them each of the different costs of the plan, and then based on if they completed it or not, they will get the lower cost. You can also see that when I changed it from family coverage or Plan A and member family coverage, Prince White was down in this box. However, when I switched it to member only, it shows just Snow White. So it does show all that are eligible to be covered within that coverage type. So if I were to select member and spouse for her, you can see the first member and spouse selection, which has no wording after, says this is the member and spouse full plan. The spouse is unemployed, self-employed, retired, or has no other ACA eligible coverage, available through his or her employer, or is a Kroger employee. And then it mentions the biometric screening as well. Now, if the individual happens to have the working spouse fee, then you would have to click on member and spouse plus working spouse fee. We talked about this before. It's going to get a little dicey. We will be reviewing these to make sure they are done correctly, but just bear in mind that there are multiple selections for those who are covering their spouse. And this is specific to the new Southwest contract for 2019. So member and spouse full plan, you can see that it mentions the spouse has other ACA coverage, but is opting to enroll in this plan as secondary. You can see the difference in the premium when you add the working spouse fee. Now, if this individual wanted to cover just themselves for full coverage, so medical, dental, and vision, they could select member only full coverage. And if they wanted to have their spouse for dental and vision, they could select that option as well. So it says member only, full coverage, spouse, dental and vision coverage only. That's a big difference between selecting member and spouse up top, where both the member and spouse are getting the full plan. So again, double check, review with your participant to make sure that they understand what they're selecting for their enrollment, whether it be family, member only, member, spouse, dental, vision. And again, this box will only show the coverage types that they are eligible for. So if Snow White was only eligible to cover herself and not her spouses or children, only member would be available. So I'm going to sign her up for a member and spouse coverage, and we're going to move to the next page. Also, if you did need to add any other eligible family members to the plan, you could click Add Edit here and add, say, a son, daughter, whoever's not showing underneath this list. Moving on to the next page, we have the beneficiaries. So it shows that she elected the Plan A, 80% coverage, member and spouse plan. Again, it lists out the description. And then it shows who is elected as her life insurance beneficiaries. So currently Prince White and Grumpy White are the primaries at 50-50, and Happy White is the secondary. You can change this as much as you want. You can add a dog, you can put to an estate. Just remember that when you are putting in the distributions, the primary and the secondary, if a secondary is available, have to equal 100%. If everything looks good, you can move on to the next page. In the next section, we'll be asking you about additional enrollment insurance information. So if either of these individuals do have other coverage, say if Prince White had any type of other coverage with Anthem, you could put that in this box. If they know the policy number, that's great. The only information we do need is the insurance company. If they don't know it, you can put unknown in the box as well. We will reach out to that individual to follow up on this information. It will also automatically fill in the effective date of 1/1/2019 for you. If you don't have any changes to this, you can just leave this area blank, and you can click Next to move on to the next section. The last three questions are asking for the marital status, and if the covered spouse, if they are covering a spouse, is unemployed, employed, self-employed, or retired. The only question that needs answered on this page is the first question, as you can see with the asterisks. We just need to know what their marital status is. So for this individual, I would select married, unselect single, and then I could actually skip past these other two questions. However, because I know the information, I could say that the spouse is unemployed, and this spouse is not on this plan. Or I could select the spouse will have medical insurance. Again, if you don't know the answer to these two questions, just skip it, move on through, it's okay. So the last page is going to be your enrollment summary. Going through here, it'll tell you the benefit election that you selected, the coverage type that you selected, and the premium, also the premium if they complete the biometric screening by December 15th. It will show the covered family members based on what was added in. It will show the life insurance elected beneficiaries, and then it will show if you added any additional insurance coverage information. If all this looks correct and the member is okay with this information, you can go ahead and click Submit Enrollment. Once you submit the enrollment, it will ask you if you're sure, and then it will complete the enrollment. Once enrollment is complete, it will come up at the top with a confirmation number that you can write on the back of the card, and it will also give you the opportunity to print or email this summary page for that participant. If there is already an email address on file, it will send an email out automatically to that participant's email address. If they have a different email or would like it sent somewhere else, you can type that email into the box and send it out to that email address. And other than that, that's it. So that will submit the enrollment for this individual. I'm going to stop here so that I can still use this as a test account. But if you do have any questions, you can always contact us here at the fund. You can contact myself. You can contact Missy. We're more than happy to help you with logging in, getting access to open enrollment, or if you have issues with your username and password.